talk about the post I just made about medical assistants. I'm looking kind of rough. My allergies are kicking my ass hardcore. At least I'm hoping that's what it is. But anyways, the post says medical assistants at the heart of healthcare, or your healthcare, something to that effect. So the question is, who are medical assistants? That's my first degree. As a rule, you can just get a certification, meaning you just, in most places, went a year to a technical school, vocational school, and you got your certification, meaning you completed all the classes and credits and all of that. So I did that, and I completed, basically I went double full-time for a year. Sorry about my voice. For a year. So I did 8 to 2 at Ben Franklin, which is our local community college, technical side, whatever. And then I had an hour break, and I went over to the university from 3 until usually 8 or 9, Monday through Thursday, I think. And then Friday I had morning classes, and then I went to work. Saturday I worked probably 16 hours, and same with Sunday. So it was a very, very, very busy year for me and exhausting, but I got a associate's degree in a year, so that's pretty good. You don't have to have an associate's degree to practice. You do have to, well, a lot of the people that are doing the medical assistant job aren't necessarily medical assistants. There is a difference. If you didn't go to school, there is a difference. You can be nationally registered and certified, and you can have a degree. Each of those should pay you more for every tier you go up, but mine didn't. When I first started, I was a medical assistant at a pain clinic. And a girl that got hired like a week before me only had a certification. I had a national registration and the degree, and we made the exact same amount. She didn't have experience or anything like that, so that she would be paid more, and it was a very, very low rate, and we made the same amount. I later found out that people in registration made more than me, which is ridiculous. You know, they sit there and type in stuff. And if you think, who is your medical assistant when you go to the doctor? 9 out of 10 times, that's that person that comes in. They call you out of the waiting room, come back, do your vitals, whether it's your temperature, blood pressure, heart rate, or in the pain office that I worked in, it's what's your pain scale, what's it feel like, and of course your vitals. And then I worked in an eye doctor's office for maybe 4 years. I can't remember exactly. And that is actually a much different job. You don't have to be a medical assistant to work in an eye doctor's office, but I basically got hired on the spot because of that, and having my eye experience personal. So it was an instant hiring thing. That person at the eye doctor's office, they bring you back. Almost always that's the person that gets you out of the waiting room. And they do all of your pre-testing. Now, usually the optometrist and the ophthalmologist, the people do different things. An optometrist office, mainly they just do the pre-testing part. So they do the autorefraction, which gives you that guess. They'll do visual fields, OCTs, retinal photography, all of the diagnostic things like that. They will give you your eye tests, like have you read the charts, and they'll take your medical history. So at the optometrist's office, that's usually all they get to do. In an ophthalmology office, I got to do so much more. At that place, I was able to do the exam. So basically all the doctor had to do was come in. Yeah, they did the exam part, like through the slit lamp again and verified that everything that I had down was correct. So I was that person that did your better or worse, the thing that they click, better 1, better 2. I did that, and it's actually a lot harder than you would think while you're sitting there. I also did the manual slit lamp exam, which I learned so much. So anyways, there's a lot of different roles that they can take on based on what office you're in. Some medical assistants don't work in the back office at all. They work up front. They might be that person that checks you in and gets your insurance and that type of thing. They might be the person that checks you out, and they might be the person that does billing. There's a lot of things. They can be the office assistant, or not the office assistant, office manager, sorry. There's a lot of different things you can do, but some of the stuff that you learn in school is how to draw blood, how to do an EKG, which is, all that's patches on your chest that monitor your heart rate as they're on there, and your rhythms. We learned how to do that. We learned how to do blood typing, urine testing. I'm sure we learned a lot more than that. That's all I can think of off the top of my head. I worked in a general office for 2 weeks, and I absolutely hated it. I didn't particularly want to be a medical assistant in the beginning because I thought it was gross. But when I went into the regular office, that person draws your blood. That person, when you go pee in a cup, has to go back with a strip and dip it in your urine and test it like that. If you need a urine culture, then they have to do a couple other steps and deal with your pee for quite a large amount of time when it's not your own pee. It's pretty gross. And then, let's see, I assisted with pelvic exams, like annual pap smears for women. I didn't necessarily do anything, but I handed the tools to the doctor, and for whatever reason, I don't understand why, because she was a female doctor, I had to be in there to be a second person. And a lot of times that'll happen if it's a male gynecologist, but usually not female. Excuse me. So I had to do that. The worst thing, the most absolutely horribly disgusting thing that I had to do there, I mean, there was a lot, but this one, a lady was coming in with ear pain, and so I just worked her up. And generally, what's your medical history, yada, yada, yada. Doctor comes in, does an assessment, comes out and tells me, hey, we're going to do, I don't remember what she called it. I think it was like a flush or something to that effect. Well, I'd never done it, so I had to watch someone else do it, thank God. So basically, she put, I think it was peroxide in a syringe, not with a needle, but just the syringe part, and had the patient hold this, that little kidney-shaped puke tray. She had to hold it right here. When she put the peroxide in the ear, it came back out with earwax and God only knows what. I mean, it looked like living frickin' creatures coming out of her ear, and it was horribly disgusting. Like I said, I only lasted for 2 weeks there because that's not my jam. I'm able to draw blood, but I don't want to do it. I mean, there's a lot of dangers when that, phlebotomist or medical assistant, you're dealing with other people's bloods, and you don't know, do they have HIV? What happens if you accidentally stick yourself? Now, there's a lot of precautions now that weren't in place before. They have the retractable needles and the caps that you just push up on, but a lot of the time, when I was in training, you had to put the cap, I don't know if you can see this, no, you can't see it, you had to put the cap back on, so it increased your risk of being stuck a lot. So anyways, why am I here talking to you about all of this? 9 out of 10 times, we don't get credit at all, yet we're doing a good majority of the work. A lot of the pre-workup stuff is us. A lot of the documentation is us. but we don't get credit for that. And a big thing that really irritates me, and it's common no matter what office you're in, they will refer to you as the nurse. I need to speak to Dr. So-and-so's nurse. Well, 9 out of 10 times they're not a nurse. They're a medical assistant. Really, people call people that check you in nurses. I mean, that's just a generic term. When you say medical assistant, most people don't even know what that is, what they do, what the education was. I mean, what they're allowed to do. None of that. So, excuse me. I just wanted to come on here and shed some light on that. I mean, I personally like to ask them, just because I'm nosy, and that's just me. What are you? Are you a medical assistant? Because sometimes they can be a CNA, which is a nursing assistant, or which is lower than us. Or they can be a nurse, or they can be a LPN, or they would just be some Joe Blow off the street, and I'm just nosy, and I like to know that kind of thing. But we're very undervalued, and that's not just by patients. That's very often the case with the doctors. You know, if you're in an office where there's nurses and medical assistants, we almost always do more work than them, yet they get paid exorbitantly more money, and they have clout that we just don't ever get. So if you know a medical assistant, I'm sure there's probably a medical assistant day out there. I don't particularly know when it is, but tell them thank you, because they have a hard job. They do a lot. When I worked in the pain clinic, I worked with, he's in this group, I don't know if he watches my videos or not, Will, and that was a wonderful experience. I mean, I learned a lot about pain management before I ever had pain. That's helped me now. I learned about trigger points and injections and stimulators and pain pumps, and I mean, all kinds of things that at the time made no matter to me. But now that I have pain, chronic pain, it helps me. And even though I didn't want to be a medical assistant, and I didn't work in it incredibly long, you know, I went on to get my croupier is what it's called. Basically, I was a table games dealer, so I worked craps, roulette, and blackjack. Paid probably 7 times as much money, but you know, you could be Joe Blow off the street, go to class. As long as you pass your background class or your background check, you're a dealer. After that, I went on to be a chemical plant operator. That was my second degree. So I didn't necessarily work for a horribly long time in the field, but now that I have my medical issues and now that I have this page, I understand things so much better. When you have your report, we learned a lot of medical terminology. When you have your report from either your doctor or your x-ray or anything like that, a lot of times I don't have to Google it because I know what that is. A lot of times I can, you know, if you tell me you have this type of pain, a lot of times I'm not a doctor. Don't, you know, take my medical advice as law, but a lot of time I can give you some advice on, you know, maybe try this, right? It's helped me tremendously with just my medical records, and for a lot of different reasons. I mean, how many people know that you have access to your medical records no matter what? Not very many people. I know all of the HIPAA laws, and I know how to get around a lot of the time limits and all this back office stuff that no one really thinks about. So even though I didn't want to do it, and even though we are truly undervalued, I have used it probably every single day in the last, I'm going to go with 10 years. Every single day. I mean, all the time. So anyways, I'm hoping that you learned something in this video, and you learn to value every part of your medical team, because they all have a very integral part of your healthcare. So you guys